Welcome to The Secret Files, a podcast series sponsored by Cutera. Thank you for joining us for this three-part series where we'll explore secret RF, a fractional radio frequency or RF microneedling system. Cutera gathered thought leaders to discuss this new technology and its applications. Dr. Ashish Bahtia.
I'm Associate Professor of Clinical Dermatology in Northwestern University in Chicago, and also practice in private practice here in the suburbs of Chicago at Oak Dermatology.
Moderated the conversation along with Dr. Jeffrey Hsu. Dr. Hsu is co-founder of Oak Dermatology with Dr. Bahtia. He is also a clinical assistant professor at the University of Illinois, Chicago.
There's currently a lot of excitement about microneedling, even on a social media platforms, but I think there's a bit of confusion between energy-based microneedling and standard mechanical microneedling.
In light of this potential confusion, Dr. Hsu asked his colleagues how they explain the differences between conventional mechanical microneedling and energy-based microneedling.
There's a lot of differences between, as we all know, between the mechanical and energy-based microneedling.
Dr. Manu Agarwal was the first to weigh in. She's a board-certified and aesthetic laser-certified family physician specializing in vein disease. She founded the Vein Care Center Laser Specialists in Lima, Ohio, and is also an associate professor at Athens College.
The best way that I explain it to my patients is, with a mechanical device, you're just creating trauma essentially to the tissue without delivering any energy. So you're not able to address the deeper layers of the skin that mechanical microneedling doesn't address at all. Whereas with the energy-based, you're able to go to deeper layers, create less trauma, less downtime. There's also a lot of discrepancies in mechanical microneedling. There's a lot of home devices that have variable depths on the needles, variable makes of the needles when they're made of different types of tips. Some of them are stainless steel, some of them are not. It's never something I offered in my practice, but talking to other folks that have had mechanical microneedling and now have switched to energy-based microneedling, they notice a lot less downtime for patients, a lot less trauma, a lot of less swelling, and better results. And so that's kind of how I go over it with patients in my practice.
I don't even confuse the situation with mentioning microneedling in my practice. I call secret RF.
That's Dr. Adriana Holly, a dermatologist in private practice at the Center for Advanced Dermatology in Phoenix.
I tell the patients that that's a form of fractionated radio frequency. And I have microneedling in my practice, and I also have a full menu of lasers in my practice. And this is much more like a laser. So I completely agree with Manu in that you are going to get a far greater degree of tightening, and the downtime is much, much less than it is with standard microneedling.
Las Vegas-based dermatologist Dr. Doug Fife, founder of Avita Dermatology and associate faculty in the Department of Plastic Surgery at the University of Nevada, concurs.
I tell my patients that this is an exciting technology because the energy gets delivered right where it's needed, which is underneath the skin. So in a safe way and a controlled way, it delivers heat energy. It causes a change to the collagen that allows it to remodel and thereby tighten the skin.
Well, it's definitely several ways to explain this to patients, but I think it is important for a patient to be clear about the newer innovations and how that's different from what people are talking about in the social media and layman's discussions. But the way I explain it, there are two forces at work. You're basically improving the skin from both outside in with the needles and the mechanical control injury, but then you're also improving the skin from inside out using the radio frequency that ultimately creates neocollagenesis.
Noting that there is an overlap between the effects of traditional lasers and the secret RF device, Dr. Hsu asked the panelists when they choose to use microneedling RF over other options.
I tend to use the resurfacing laser when dealing with superficial textural issues and pigmentation and discoloration issues, but I think there is a limitation to what a laser can accomplish, given that a laser can only penetrate so deep into the dermis, and we can go much deeper at different adjustments using the secret RF, and that's why when dealing with deeper structural issues, severe rhytids, deep scars, I'm looking to my secret RF.
The minimal downtime associated with treatment was surprising to Dr. Hsu.
I expected lengthier downtime from the procedure.
However, he says recovery has been easy compared to traditional laser devices.
I think it's fabulous.
Dr. Agarwal has never offered ablative or resurfacing devices in her practice. She added secret RF this year.
One of the reasons why I added the secret RF is because of the darker skin types that you're able to treat. And so, in my town, Midwest part of the country, you can't ask a farm girl or a farm boy to take off a week. They just can't afford it. And so it's been a really great selling point. There has also been some great literature to support using radiofrequency microneedling over resurfacing lasers. There's actually been some nice studies that have shown that you can actually get similar, if not better, results without the downtime with microneedling RF versus an ablative type of laser or resurfacing laser. So it has been a great selling point for our practice for patients.
First of all, I wanted to add that I use my CO2 laser pictures to sell the secret. I show, a very, very nice before and after of the CO2 laser, and then I show the patients, this is what it used to be like on day 1, post-op day 2, post-op day 3, etc. So they love the fact that they have minimal downtime.
Dr. Holly adds it's essential to discuss downtime before treatment.
I think it is beautiful that we're getting results that are on par or even better than what we're getting with fractionated CO2 resurfacing, and yet a fraction of the downtime. I think it's just because we're able to deliver energy where it needs to go without the unnecessary collateral damage. And that's the beauty of having the option of an insulated needle. About approximately 80% of the energy and the heat is delivered deep into the dermis, so the epidermis can heal very quickly. Like some of you said, in a matter of 1 or 2 days.
You've now had the opportunity to get to know the secret RF. You know what the system is and some of the unique advantages of radiofrequency microneedling. In the next episodes in this series, we'll explore why the experts turn to secret RF and take a deep dive into how they use the device in their practices. To learn more about secret RF and how it may fit in your practice, visit Cutera.com.